Hi, this is Bree. This is my oral presentation on acquired immunity and the smallpox virus specifically. Thanks. Active immunity develops in response after the immune system responds to being exposed to a foreign antigen. This response occurs either naturally, like we see in our first, second, or third from immune responses, or artificially, where the antigens are put into the body through a vaccine, causing the body to then respond by making antibodies. Passive immunity is acquired when antibodies are transferred from one person to another. This response either occurs naturally, like we see in the transfer of maternal antibodies, whereas artificial passive involves a person receiving manufactured antibodies via an external delivery, as seen in gamma-globin injections. Maternal antibodies are transferred from mother to child, and these passively acquired antibodies enter the child's bloodstream, acting as protection in their body, similar to how actively produced antibodies work. Maternal antibodies are transferred through the placenta during birth. Maternal antibodies actively span over 6 to 12 months, with the antibody concentration gradually declining continue. Therefore, increasing the duration of the mother choosing to breastfeed would potentially link to an increased immunity for the baby. Smallpox is an acute contagious disease caused by the variola virus, a member of the genus Orthopoxvirus. The virus is estimated to have originated from an African rodent poxvirus 10,000 years ago. The virion is a double-stranded DNA genome, and this DNA is bound to proteins in the core of the virion. The core that's enclosed by the membrane is described to be dumbbell-shaped, narrowing at the center of the virus. Once smallpox has entered through the first and second lines of defense, the virus invades more macrophages and endothelial cells in the liver, spleen, lymph nodes, and bone marrow. It's also been suggested that the virus uses chemokine receptors like CCR5 to enter the cells. Smallpox transmits via close contact, mainly via the respiratory tract, when saliva droplets are sprayed from coughing and sneezing. The virus is also passed through direct contact, usually within 2 meters. Less commonly, it's spread through contaminated fabrics such as bed linen and clothes. The first time an individual is infected with the virus, the immune response is slow as it hasn't been exposed to these foreign antigens before. The smallpox virus has multiple vital effector proteins that act as chemical agents that cause modifications to the immune system and its functioning. These proteins target key innate pathways such as interferons, inflammatory cytokines, chemokines, complement, and the TLR family of pattern recognition receptors. In the cell-mediated response, the antigens that are being displayed on the infected cells activate the helper T cells to stimulate the cytotoxic T cells. These cytotoxic T cells then bind to the infected cell, transferring perforin to increase the membrane's permeability, creating channels within the infected membrane, causing the infected cell to lysis. Through this cell-mediated process, the memory T cells are also given rise to, which is useful in the second infection is to occur. Contrastingly, in the humoral response, the helper T cells stimulate the B cells, which in turn give rise to the plasma cells that secrete antibodies. The antibodies stop the virus from attaching to normal cells by binding to the antigen surface. This assists in macrophages' ability to recognize the viral cells, making it easier for them to engulf them when the antibodies are present on their surface. During the process of the activation of B cells, B memory cells are also created to combat the virus if there was a second infection. Comparatively to the first infection of smallpox, individuals who are infected for the second time already have tailored T and B memory cells that are equipped with the means of eradicating the smallpox virus at a much faster and stronger rate. T memory cells develop after a pre-existing exposure to the smallpox antigen, and therefore they are able to react by providing rapid protection. This occurs the same in memory B cells, where the foreign antigen they've already encountered before exists within the body. The B memory cells then encounter the antigen's actions at a much faster rate, decreasing the duration at which the viral cells have to hijack healthy cells. The main symptoms for smallpox include flu-like symptoms, a distinctive rash with multiple small raised bumps that first appears on the face, hands, and forearms, and then on the torso. However, it's also common for people with smallpox to experience pain in the back or muscles, blistering, scabbing, or scarring caused by the rash, a fever, headaches, and vomiting. Currently, no cure for smallpox exists. In the event of an infection, treatment would focus on relieving symptoms and keeping the person from becoming dehydrated. Antibiotics might be prescribed to a person that also develops a bacterial infection in the lungs or on the skin. Variola vaccine is the only treatment towards decreasing the severity if an individual is to be infected. Regarding the contraindications of the smallpox vaccine, patients with a history of eczema or dermatitis, pregnant women, and women who are currently breastfeeding, and people who have weakened immune systems, such as cancer patients, it's also suggested that individuals younger than 12 months of age shouldn't be vaccinated. The potential risk for someone with eczema or a pre existing skin condition is that if they were to be vaccinated, they could develop eczema vaccinatum, which is the ability to spread an extensive rash and systemic illnesses. When we are vaccinated with the smallpox virus before even being exposed to it, our immune system is exposed to a small dosage of foreign antigens that spring our immunity into defense, fighting off the antigen. Through the controlled process of the smallpox vaccine, our B and T cells are stimulated to give rise to memory cells that are then needed in the case that an individual is to experience the virus for a second time. The vaccine for smallpox contains live vaccinia virus, which is similar yet a milder version of the variola. Vaccine boosters are ultimately an extra dosage of a specific vaccine that an individual has already been immunized for, and its role is to ultimately heighten a person's immunity, enhancing their ability to cope if they do get infected again. If you are exposed to an area that's prone to the smallpox virus, it's advised that you get booster shots every 3 years to maintain an immunity that could combat the smallpox virus. Mass vaccination means vaccinating as far as, quote, every man, woman, and child, although the World Health experts recommend vaccinating at least 80% of the population to achieve herd immunity. In the case where herd immunity wasn't used in a population susceptible to smallpox, a large percent of people would become infected, causing an increase in mortality rates, which could cause an increase in the amount of healthcare professionals within our hospitals. This could cause a possible economic downturn, leading to increased unemployment rates, ultimately grinding society to a halt.